Welcome to the Depth Dive, the show where we cut through the noise and get straight to the knowledge that genuinely makes you smarter.
That's the goal.
You, our listener, are constantly looking for ways to learn quickly, effectively, and most importantly, deeply. But have you ever stopped to wonder how we really know if that course, that workshop, or even that insightful article you just consumed actually stuck? How do we measure if it truly translated into, real-world impact?
It's a huge question.
Yeah.
So much information out there, but what actually changes things?
Exactly. So today, we're taking a deep dive into precisely that. We're focusing on how we measure the effectiveness of educational programs, specifically through the lens of research methodology workshops.
And we've got a great source for this.
We do. We'll be unpacking a fascinating paper called Research Methodology Workshops Evaluation Using the Kirkpatrick's Model, Translating Theory into Practice. It was published in Medical Teacher back in 2014 by Hamza Mohammed Abdulghani and a team from King Saud University in Saudi Arabia.
Right. And our mission today, really, is to get a solid understanding of this Kirkpatrick model. It's a powerful and, frankly, long-standing framework for evaluating training.
Been around a while.
Oh, yeah. And then we'll see what this specific study revealed about improving these really crucial skills for healthcare professionals, like research methodology.
And what makes a workshop truly effective, right? Beyond just, people saying they liked it.
Exactly. Far beyond good reviews. It's about how learning actually translates into changes in practice and meaningful outcomes.
Okay, let's unpack this then. Before we dive into the specifics of these research workshops, we need to get our heads around this tool the researchers used, the Kirkpatrick evaluation model.
Definitely.
You mentioned it's long-standing. It's not some new fad. It's actually been a primary design for training evaluations for, over 30 years?
That's right. Over 3 decades. And it offers this wonderfully structured way to look at the full, multi-layered impact of pretty much any training program.
So why is having a model like this so important?
Well, in just about any field, there's this growing pressure to evaluate academic and professional programs. People want to know they're truly meeting their objectives, not just ticking boxes.
Makes sense. Accountability.
Exactly. And the Kirkpatrick model gives you a comprehensive 4-level strategy for doing just that. It moves from the immediate reactions right up to the long-term tangible results. It's like a roadmap to assess genuine effectiveness.
Okay, so 4 levels. Let's break them down. What's level 1?
Level 1 is all about reaction. This is the most immediate one and probably what most people think of first with feedback.
Like the happy sheets.
Pretty much, yeah. It simply asks, how did participants feel about the training? Were the instructors engaging, materials relevant, setting okay, activities useful? It measures satisfaction, usually with those quick questionnaires right after a session.
Got it. So the gut feeling, what's level 2?
Then we step it up to level 2, learning. This level goes deeper. It asks, did participants actually acquire new knowledge, master new skills, or maybe even shift their attitudes?
So beyond feelings, did they actually learn something measurable?
Precisely. It's about capability change. And you'd typically measure this using things like pre- and post-tests, maybe quizzes or skill demonstrations to gauge that gain in knowledge or cognitive skills.
Okay, makes sense. Reaction, then learning. What's level 3?
Level 3 focuses on behavior. Now, this is where, the rubber really meets the road.
Right. Does it actually change what they do?
Exactly. Did participants transfer what they learned in the classroom or the workshop to their actual workplace or their professional practice? Did their behavior or job performance measurably change because of the training?
How do you even measure that? Seems tricky.
It can be. Sometimes it's through direct observation, sometimes self-reporting, maybe manager feedback, but it speaks directly to the practical application of the new learning.
Okay, reaction, learning, behavior. That leads us to level 4.
And finally, yes, level 4, results. This is often the bottom line, especially for stakeholders, for the people funding the training.
The big so what question.
You got it. What were the main outcomes? What were the organizational benefits that came from this training? Did it lead to, say, increased productivity, better quality, lower costs, maybe improved morale?
That sounds like the hardest one to pin down.
It often is the most challenging, yeah. Because so many factors contribute to organizational performance beyond just one training program. But it's often the most sought-after level of proof.
So what's crucial here, I guess, is that these levels aren't just separate boxes, are they? They connect.
Absolutely. They build on each other. A positive reaction at level 1, well, that can help facilitate learning at level 2.
Makes sense. If you hate it, you probably don't learn much.
Right. And then that learning hopefully translates into behavior change back on the job at level 3, and ultimately, fingers crossed, you get those desired results at level 4.
So it's not just a checklist, it's more like a pathway, a sequence.
Exactly. A clear sequential pathway to understanding the full scope of a program's effectiveness, from that initial feeling about it right through to seeing real, tangible benefits. It tells a whole story.
Okay, that framework is really helpful. So, with that in mind, let's set the scene for the specific study we're looking at. The Faculty Development Unit at King Saud University, they held 5 research methodology workshops, right, between 2010 and 2013.
Correct. 5 distinct workshops.
And these weren't just like generic sessions. They were designed specifically to equip faculty and healthcare professionals with a whole suite of essential research skills.
Yeah. Pretty comprehensive. Everything from formulating research questions, doing literature reviews, writing proposals, data collection, analysis.
All the way to writing manuscripts for publication, and importantly, handling the ethical side of research.
Ethics was key. And the study involved a decent group, 116 participants, and really diverse backgrounds, too.
Yeah, I saw that. Medicine, nursing, pharmacy, dental, biomedical tech, that's quite a mix.
A really rich cross-section of healthcare pros, which makes the findings, I think, even more interesting.
Definitely. So they applied the Kirkpatrick model. Let's start with level 1, reaction. What did they find? How did people feel about these workshops?
Right, so level 1 reaction. The findings here were actually quite nuanced. It wasn't just universal praise, which is realistic, I suppose.
Yeah, rarely is.
So about 24.1%, nearly a quarter, they categorized as liked with appreciation. These folks pointed out specific positives, things like the small group sessions being effective, good organization, relevant topics, and especially the hands-on SPSS software practice.
Okay, so they saw real value.
Yeah. Then you had a bigger chunk, 53.4%, who liked with suggestions. So positive overall, but they had ideas for improvement.
Like what?
Things like wanting more practical exercises, maybe longer workshops to really absorb everything, definitely more hands-on SPSS time, better time management in sessions, and maybe fewer pure lectures, more doing, less listening.
Sounds familiar for worktop feedback and the rest. Was there anyone who just didn't like it?
Yes, about 22.4% actually disliked certain aspects. Their criticisms were varied. Some found speakers hard to understand due to low voices or accents. Others felt topics were crammed into too short a time. And some pointed to general organizational hiccups.
Things that can really get in the way of learning.
Absolutely. We've all been there, haven't we? Struggling to hear or feeling rushed.
Definitely. But here's what I found really interesting in the paper. How the organizers actually used this feedback. They didn't just collect it.
No, that's the key takeaway for me, too. They actively applied the suggestions in the later workshops. It wasn't just filed away.
Can you give an example?
Sure. There was a direct suggestion on day 1 of the second workshop, asking for more small group discussions. So they actually implemented that in the following days of that same workshop.
Wow, that quick.
Yeah. And another time, participant feedback led them to add a whole new session just for discussing individual research proposals, and also an interactive presentation on data patterns to make the stats intro a bit more engaging.
That iterative, responsive approach, that seems crucial.
It really is. It shows a real commitment to the learners and to making the program better over time. Too often, feedback is just, an endpoint. Here, it fueled improvement.
It's about being agile, isn't it? Not just delivering the same thing over and over.
Exactly. It transforms feedback from just a report card into an engine for evolution.
What do you think stops more organizations from doing that? It seems so logical.
Often it's perceived lack of resources, time, people, budget, and sometimes, frankly, it's a culture thing, viewing feedback as criticism instead of, a gift.
Yeah, defensiveness can creep in.
Right. But this study really shows the payoff when you embrace that feedback loop. It's a powerful lesson for anyone running any kind of program, even just a meeting. Shows real commitment.
Okay, so the organizers were smart, they listened, they adapted, but the big question remains. Did people actually learn anything? Did the needle move on their knowledge and skills? That brings us to level 2.
Precisely. Level 2, learning. This is where the hard data, the pre and post tests come in.
And what did that data show? Well, the results here were pretty encouraging overall. The mean scores on tests covering basic knowledge and cognitive skills showed a significant improvement across all the workshops, 17.67% improvement, actually. Wow, nearly 18%. That's substantial.
It is. To put numbers on it, the average pre-test score was 23.30, and it jumped to 32.14 in the post-test. And crucially, This was highly statistically significant p-value, less than 0.005. So very unlikely to be just chance. They genuinely learned.
That's impressive. Were there specific areas where they saw big jumps?
Yes, definitely. They saw particularly strong gains in some really fundamental research topics, like understanding SPSS software that had a p-value of 0.001, very significant. Biostatistics also showed strong improvement, p equals 0.015. Same for data collection and qualitative research.
All core skills for
There's
researchers.
absolutely essential competencies.
But, okay, here's the question. Did everything improve like that? Or were some skills harder to shift in a workshop setting?
That's a really sharp question, and yes, the study highlights that nuance. Not all schools improved equally.
Which ones were tougher?
The researchers found that more complex sort of synthetic skills like writing manuscripts and writing proposals, well, they showed only slight improvement, and it wasn't statistically significant.
So people didn't get much better at actually writing the big papers or proposals just from the workshop.
Not significantly, based on the tests. And the researchers themselves point this out. They note that these complex skills, and I'm quoting loosely here, seem to develop slowly and possibly require multiple and repetitive interventions.
Ah, okay. So it's not a one-and-done thing for those really complex tasks.
Exactly. It's like you can learn the rules of chess in an afternoon, but becoming a grandmaster takes years of practice, study, playing.
That makes total sense. The workshop gives you the foundation, maybe the tools, but mastery takes time and, like they said, repetition. Does the paper suggest how to support that longer-term development?
It implies it, I think. It suggests that while the workshops are crucial for the basics and getting started, true mastery of things like manuscript writing probably needs more of a, let's call it a learning ecosystem.
Like ongoing support.
Yeah, maybe ongoing mentorship, peer review groups, structured practice with feedback, perhaps follow-up advanced workshops. The initial event provides the toolkit, but you need sustained engagement over time to get really proficient.
That's a really powerful distinction. It shifts how you think about training for complex skills. So knowing they learned the basics, but maybe not the complex writing yet. Did this learning translate into action? Did they actually do anything differently back in their jobs?
Right, this leads us perfectly into Kirkpatrick's levels 3 and 4, behavior and results, real one-world impact.
So level 3, behavior. Did they change what they did?
Well, according to the follow-up, yes. A pretty substantial 79% of participants reported that they transferred the training skills to their workplace.
79%, that's high. Self-reported, you said.
Yes, self-reported, which always has some caveats, but still, it indicates a strong perceived application of the learning. The vast majority felt they were using what they learned.
Okay, so they felt they were using it. What about level 4, actual measurable results? Did anything concrete happen?
This is where it gets really interesting. For level 4 results, they found some compelling outcomes. Of those 116 participants, over half, 56.9%, reported starting new research projects after the workshops.
Starting projects. That's a concrete action.
It is. Moving beyond just applying a skill to initiating a whole endeavor. And even more concrete, 6.9%, which was 8 participants, had already published research articles based on work possibly initiated or helped by the workshop skills.
Wow, actual publications. That's often seen as the gold standard outcome for this kind of training, isn't it?
It certainly is a very tangible and valued outcome in academia.
Those are impressive numbers, especially getting people to start projects and even publish. But I have to ask, did the study say this was all down to the workshops, or did they acknowledge other factors?
No, they were careful, quite rightly. The study acknowledges that you can't solely attribute these outcomes, like starting research or publishing, only to the workshops.
Right, because people have different backgrounds, motivation.
Exactly. Prior experience, inherent drive, the kind of support they get back at their institution, all that plays a role. However, the study strongly suggests that acquiring these skills through the workshops significantly contributes to improving the overall research culture within the institution.
Oh, so it's not just individual impact, but shifting the environment.
Precisely. It's like the workshops act as a catalyst. They don't just build individual skills. They help create an environment where research is more valued, more common, maybe more collaborative. That's a huge result in itself.
And you mentioned the mix of professions earlier. Did that help?
Absolutely. The paper highlights that the interprofessional nature, having doctors, nurses, pharmacists, etc., all learning together, fostered a great exchange of views and really helped promote that shared research culture and built a kind of community.
So pulling it all together, what does this mean? We see this clear line, don't we? from positive reactions, which were acted upon,
Hmm.
to measurable learning, especially in foundational skills,
Right.
to reported behavior change, and finally to actual results like starting projects and publishing.
It really is a powerful demonstration of a well-designed and adaptable training program, one that was evaluated strategically.
Yeah, it shows it's possible to go beyond just imparting knowledge to genuinely influencing practice and outcomes, maybe even at that broader cultural level.
Definitely.
This whole deep dive, looking at Kirkpatrick and these specific workshops, it offers such valuable insights, whether you're, designing training for your own team or participating in courses yourself, or even just curious about what makes learning actually stick.
It really does. We've clearly seen how a structured approach like Kirkpatrick's gives you that comprehensive view from the immediate did they like it, all the way to did it make a difference long term.
And that crucial piece about feedback.
Oh, absolutely. How vital it is not just to collect feedback, but to act on it. Even the tough stuff, the negative comments. That continuous adaptation that's not just a nice to have. It seems essential for making a program truly effective and robust.
Totally agree. And for you, the listener, you can actually use this kind of framework yourself. When you take a course or attend a workshop, think beyond just, did I enjoy it? Ask yourself, is this learning truly sticking? Is it changing how I behave professionally or personally? Is it leading to real results for me?
It's about being a more discerning learner, isn't it? Understanding where your time and effort are genuinely creating impact, not just, consuming content.
Precisely.
And, it leads to a final kind of provocative thought for you to mull over.
Okay, let's hear it.
If we accept that knowledge is most valuable when it's truly understood and then applied, how can we, all of us, whether we're learners or educators, how can we consistently bridge that gap between knowing something and actually doing something with it?
Especially for those really complex skills.
Exactly. Especially for those complex skills that, as the study showed, seemed to develop slowly and need multiple, repetitive, maybe varied kinds of interventions over time. How do we design for that sustained engagement, for deep, lasting impact?
That is a profound question. How do we bridge that knowing-doing gap, especially for the hard stuff? Something to definitely think about.
Indeed.
A question that really echoes through every learning journey. Thank you for joining us on this deep dive into the true measure of learning.
My pleasure.
Until next time, keep learning, keep questioning, and keep making that knowledge count.